We've heard it referred to as many things: a double chin, turkey neck, even a waddle. How about a goozle? But what causes the sagging skin under our chins, and more importantly, can we do anything about it? Well, joining me virtually today from Beverly Hills, California, is double board certified plastic and reconstructive surgeon, Dr. Charles Galanis. Good morning, Doc. Thanks so much for being a part of the show.
Thank you for having me. It's a pleasure to be here.
Absolutely. Look, let's dive right in. What causes this situation, and is it as common as it seems?
To begin, we need to start with a discussion of the structure underneath the skin. What we have is a network of collagen and elastin, and that's really what provides the support and the elasticity of our skin and soft tissues. Now, for both men and women, as we age, we lose a lot of that collagen, and that leads to that aged appearance, whether it be sagging in the jowls or the neck. And it's not just with aging, it can also occur with significant gains or loss in weight.
We're here today to share one of the newer innovative procedures available for patients using a helium-based plasma. Now, tell us a little bit about that.
Renuvion is an FDA-cleared device for a minimally invasive procedure that we use to improve the appearance of the aged chin and neck. It's a small probe. It's a minimally invasive one-time procedure. The probe goes underneath the skin and uses radio frequency energy and helium gas to trigger a collagen remodeling process, thereby improving the tightness of the area.
Now, Doctor, you recently gave our cameras an opportunity to take a look inside of your practice and get a closer look at the Renuvion procedure. Check this out.
My name is Shelley Church. I'm a mother of two beautiful daughters, and I noticed that in pictures my neck just looks so droopy, and I really didn't like any pictures of myself. I started looking on the internet for other alternatives other than plastic surgery, and I heard about Renuvion and did a little more research and learned that Dr. Galanis has been using this for quite some time, so I made a consultation with him.
I think of consults as informational sessions. That's all it is. So my role in these is to get an understanding of what you're looking to accomplish, because I want you to sort of take me through what your eye is seeing when you look in the mirror, okay? And I want you to kind of talk me through when you're saying the neck and what's bothering you.
Droopy right here.
Okay.
And the lines here.
Okay, so kind of in this area in the front of the neck and along here. Shelley's a great candidate because she sort of exhibits some of those early signs of aging, when people have a little bit of that skin that's getting lax along the jowls, the neck area. She's otherwise very healthy. She's interested in something that is, more of a natural aesthetic in terms of an outcome, nothing too drastic or too pulled as what you might see with a facelift. And she's at that age where it's an appropriate bridge prior to going under the knife for a surgical option. This is certainly an option to see if she can get just a little bit of tightening to buy her a little bit of time before she takes that next step.
I think after the procedure, I'm going to feel more confident about myself.
The reason I like Renuvion for patients is, we've been looking in the world of plastic surgery for years at ways to deliver results without putting people under the knife. There's really been a strong push towards what we call non-surgical, minimally invasive techniques. And that's where something like Renuvion is perfect. It fills that need of giving people something as a means of tightening tissue without the surgical option. In situations where we're doing it as an office-based procedure, typically the steps are we will pre-medicate the patient with an oral medication just to get them a little bit more comfortable, take a little bit of the edge off. We'll make, sometimes 1, 2, or 3 very, very small incisions under the chin, one each behind the ear, and through those incisions we'll inject a solution that has things like lidocaine in it. After that solution's had a few minutes to sit, then we start with the Renuvion. It's a very simple procedure. The Renuvion's a very thin probe, thinner than a pencil. It goes through the holes that we put the numbing solution in, and it delivers that radio frequency energy by way of the helium gas throughout the area. Usually it takes about 10 minutes.
Well, I'm sure everybody's pretty curious to see how Shelley is doing, so let's take a look at her before and after. And Dr. Galanis, what are we looking at here?
Well, Shelley was kind enough to send us an update photo just 4 weeks after her procedure, and already you can see significant changes in the appearance of the jawline area. The jowls have tightened up. Even the skin and the neck looks a little bit more youthful and smooth and tight.
Fascinating. Well, Dr. Galanis, what is the recovery time like, and how long before a patient actually typically sees any results?
the recovery is pretty well tolerated. Typically, I have patients wear a little neck brace that they're going to have on for a few days. I tell them to expect a little bit of bruising and swelling, but typically it resolves pretty quickly and they're able to get back to normal activity. You can see Shelley was able to walk right out of the procedure as soon as it was done. Results can be seen as early as a few weeks, but they'll continue to evolve for several months, even up to a year.
Well, thanks so much, Dr. Galanis, for being here with us today, and also to Shelley, of course, for sharing her story. And for more information on the procedure featured today, you can visit Renuvion.com. And as always, you can go to our website, thebalancingAct.com. We'll be back right after this.